Okay. Hi, Alicia.
Hello.
How are you today?
I'm good. I am excited to have this conversation together. Yeah, see where it
Yeah.
goes.
Yeah. So today we are talking about the just the concept of dance and dance therapy. This is Alisha Borges, who is our kind of resident expert on dance therapy, dance as a concept. This is something I feel also pretty passionately about, like learning to move your body and sort of work through the judgment that comes with moving your body. And I invite dance. I don't know if I invite dance as specifically as you into the room in therapy, but I definitely invite a lot of movement into the room in therapy. So I don't know if maybe you could just start by talking about like your interest in dance therapy, any foundational concepts.
Yeah, I think a big one for me to start is I think sometimes people get a little bit nervous about the idea of like dance entering the room, like, oh, I'm not a dancer. But a lot of my work has been reshifting the focus of like all movement is dance. There is an artistic flow between these movements, and finding the dance of movement is kind of its whole own path. Dance is so interesting as a healing modality because it's so old. Like humans have been dancing since we have been humans through the evolutionary chain. We have all animals and organisms moving together on this planet. And especially for humans, as we've like evolved to have this also verbal way and very cognitive way of seeing the world, even as we're developing, it's as babies, we're still just learning through movement. It's a primary language across everybody. Um, so the universality of it really appeals to me. And when dance movement therapy was really starting up as a practice, that was about in the mid 20th century. And it really started with people who were dancers, first and foremost, starting to notice especially in people who weren't dancing to be performers. Like it really evokes change in these people and starting to notice the patterns there. Um, some dance movement therapists originally that I like to name drop, especially first and foremost, is Marion Chase. She was the very first dance movement therapist registered ever. She was the first president of the Dance Movement Therapy Association. Um, and her big thing that she first linked onto was like noticing where tension is stored in the body and noticing
Mm,
patterns on where certain people are holding it and what emotions are coming up in their dance when they're leaning into that tension, when they're moving through that tension.
mm,
Um, and people actually started getting sent to her classes for like I see you're changing these people who come in and dance with you. Doctors are sending their patients, and then she ended up learning more about psychology,
mm,
and kind of weaving those practices together. Um, and now I feel like it's so cool seeing how neuroscience has kind of caught up to that, of
mm.
we've kind of moved past seeing mind and body as separate. Um, they're really, the nerves are literally all connected throughout, especially when you look at it's kind of a wandering answer, but I'm about to talk about the vagus nerve, which is literally called the wandering nerve,
Right.
because it wanders all through your facial muscles and through your throat and your lungs and your gut. And it's highly responsive to states of safety and states of connection. When we're in danger, it's responding in these different ways. Um, and that's in our body.
Right.
We have all these brain stories around it, but our body learns through this nerve and learns through patterns of interaction. And that may manifest in continuing to build tension in certain ways because it's protective. And even if there's a story there behind it, your body just bypasses. It's learned this way over and over. And you just get habitual about it. And when we start to dance and experiment, we're moving past whatever story there
Mm,
down into the body and starting to just work little by little. What is that tension there? Let's not listen to the story about it because we're trying to jump past what's here right now in
Mhm.
order to be safe, in order to keep the pattern as it's been. Um, Even if we're uncomfortable, if we've been uncomfortable for so long, that's the familiar pattern, and our body really wants to stay in the familiar. So by inviting in dance, by inviting in curiosity and play with it, you kind of bypass these just really rigid stories to explore new patterns. And
Yeah.
that's kind of a wandering answer of
Yeah.
the passion around it, of bringing dance into the room.
Yeah. Thank you so much. It's just like a really good launching off point. There's so much that you brought up. I'm thinking about, yeah, how therapy, like traditional psychotherapy, has just been like talking, two people talking and remaining very still throughout the session. And I think there's been such a shift in psychology in the last decade to embrace like body and movement and how trauma is stored in the body and how can we actually like start to move with that instead of just like talking about it, which is a very different part of our brain, right? And I do think that dance for me personally has just been a huge part of my journey. I'm just thinking about like things like five rhythms and ecstatic dance, which were recommended to me by therapists, and I was doing in tandem with therapy. And like, I mean, it really was huge for me. And then I'm also just thinking about the queer community and how dance has been like one of our primary forms of expression and liberation. Like when times have been the worst, like we can still kind of find spaces to dance together and how important that is. So can we maybe just like open up this idea of queerness and dance and how you know that how you feel about or like what comes up for you around that intersection?
Yeah. It kind of for me goes back to like there's so much story around gender and sexuality and relationship style,
Mhm.
around what's normative, what you're seeing around you, what's acceptable, what you're told growing up. And to be able to drop away from those things in dance. And especially, there's something so beautiful about working with a queer therapist, working with a queer group, when you're seen in that space of reflection and openness and curiosity to, I don't care about what stories were out there. What's happening right here? It's so dynamic, it's so complex. And yeah, so those stories are about our bodies, so using our bodies to break out of them is
Right.
so, yeah, pertinent.
Right. I mean, it's such a moment to moment thing in dance of noticing like the mind saying, oh, I shouldn't do this or I can't do this. And then the body still kind of allowing yourself to move in a certain way that might break through, let's say, like a gender norm, right?
Absolutely. And
Yeah.
to even try on and experiment, I think it feels different for people to say, like, well, how do I think about, say, femininity or masculinity, and how I'm putting into words how that feels versus I'm gonna try on feeling what dancing fully in what I think of as feminine is and just assess how I'm feeling in the moment as I do that. I'm going to swing to more masculine. I'm going to swing away from gender, what it's like for me to think of myself outside of gender and move that way. We don't have to concretely be trying to like describe and define it in that moment. It just allows for a lot more exploration and trying things off and tossing away what doesn't work and keeping what does.
Yeah. I feel like it's actually like the most queer activity possible, like actually in the present moment, right?
Yeah, it's very out of the bounds. It's very experimental. It's very, yeah, open.
Hmm. So you've written this great post about dance therapy in particular, like how you can bring dance into therapy, because we've been talking so far about like dance more
Mhm.
generally outside of therapy. I'm also just curious if you can tell us a little bit about how you work or just like the foundational concepts of dance therapy. I mean, in your article, you kind of go through these different ways that dance can come into a session. So if you could maybe just take us through some of those or just like how dance can come into the therapy room generally.
Yeah, I don't think I wrote about this in my article, but one thing that I'm seeing is kind of a through line through all of these is a really core defining term of dance movement therapy. I think for most dance movement therapists, but I definitely hold this true for myself, is kind of a triangle of awareness around breath, movement, and sensation. And those being anchors of touching into the present moment. So through all of the different exercises that I have presented in this article, um, attending to just noticing what are these things, especially without judgment, trying to take away value terms around these things, can really help. So, like one example of that, the first one that I wrote about was authentic movement. And that was pretty much coined by Mary Chase. I get Marion and Mary confused. Mary Whitehouse. Mary
Right.
Whitehouse is authentic movement. Um, and that's kind of one of the longer form practices. It takes time to drop into, but it really cultivates therapist acting as witness. So, kind of creating this open space, non-judgmental space, and also just safety wise, kind of making sure client doesn't like hit anything in the room because you invite the client to close down their eyes if that feels comfortable, or just kind of low gaze, trying to keep things tune into the moment. And then to stay still until there's the notice of an impulse to move. And just following that impulse to move, not trying to dance in any performative specific ways. And that sounds much easier than it is in practice. And talking about when it became performative, when story started to feel applied, becomes part of the debrief as well. Um, but just following these impulses, usually for it can be like 15, 20 minutes. On the longer end, it could be a whole 30 minutes of just watching the client move for as long as it feels like they want to keep that impulse moving. Often, what's found is kind of a wave throughout that of initial exploring, intensification, and as we pay attention to those impulses, some sort of resolution down.
Mm,
Um,
mm,
and sometimes that builds and builds into activation, and I might step in as therapist just to check in and see how we're doing. But afterwards, it'd be kind of client reflecting how that process went for them. And I might notice things, not what I thought was going on psychodynamically in that moment, but really trying to talk objectively about like, I noticed a big curve with your arm come up multiple times. Let's explore, like, was there any emotion or sensation, or what was it like when that curve came up or when it left? I noticed there was some tension on this side of your face. When I saw that tension on your face, I noticed in me a reaction in my stomach. That's just what I noticed that was present. And it's kind of a balance of kind of modeling my own sensory of checking in and not judging it, just naming what's happening.
right.
Kind of this back and forth of how do we just explore what came up?
Mm,
Uh, so
mm.
that's one example of a like that's a very classical dance movement therapy modality is authentic movement. Um,
Yeah, thank you. So if somebody, it's I find that I sort of do this organically in session too, but like I'm just trying to imagine what a therapy session would look like in this case. Like, is the client kind of starting the session in your typical way of like talking about something that has happened to them, and then when the emotion starts to like come up, then you kind of shift into let's be with this and let's let it move, or is there something different than that?
Kind of, there's a little bit different of a technique when it comes to here's this thing coming up, let's just let that move.
Hmm.
Because that's a little bit more dialogue and I might prompt more reflection there.
Hmm.
Um,
Hmm.
where authentic movement allows for a lot more silence. And it's usually something that I will bring up in concept in one session before even trying it in the next session, just because of the time that it takes to do it and to sense the interest in client. This isn't something that I would usually, if someone's never been to therapy before, has very little like experience with tapping into their body to jump into right away.
Right.
Um, yeah, it's
Right.
it's very like, here's the offering, here's what this exercise might bring up. Do we want to experiment with that? Are there questions about that before we go into that?
Right.
Um, yeah.
Right. So it's kind of, you're just basically setting in a space. You're creating the space where the client can just be moving their body and letting whatever arise. It's not like you're kind of waiting for this runway of what's happening in their life and what emotions are coming up. It's like you're actually saying, let's set aside this session to let your body just move and for me to kind of be there with you in that movement and sort of see what organically comes up. Does that
Yeah,
feel
for that modality at least. And
yeah,
there certainly are the routes of like, I'm seeing this thing come up. I'm just really feeling, and some people will bring it up all the time, avenue wise, just subconsciously with being like, it just feels like, and I go, oh, I noticed as we talk about that, there's so much tension right here.
right?
Let's play with that, and I'll mirror that back.
Mhm.
Um, and what if we push it to the most extreme squeeze we can get it to, what it's like to squeeze the whole body, or what does it feel like the squeeze wants to evolve into? I think for me, a lot of the point of like when we explore these movements and give them attention is I want to say like 9 times out of 10, like it will evolve into something new. It will change just by giving it the attention and exploring it in this way that's very out of the norm than we're used to doing in our day-to-day lives. Usually, oh, this feeling comes up and I just feel, and then we let it go. And
Right.
then the next time it comes up, it's right there again. It's just the impulse of it, but exploring what the impulse wants to move into and what comes up as the next thing comes up. That's the flow, that's the movement, and that's where change can happen.
That's so great. I mean, I feel like I always talk about left brain versus right brain in the sessions, left brain being like more analytical, wanting to like understand and gain insight, and right brain just being very present, very much more kind of experiential and emotional. And I feel like you're really just asking people to be with that side of themselves. I imagine you face some resistance from the more rational mind that wants the therapy session to be like productive in a specific way. Do you find that you bump up against that?
I do. Yeah. Resistance comes in so many ways. One like specific ways, there's a lot of people who go, I do not want to turn the attention into my body. Like I want to be thinking about the problems out here. And there's also a way to apply movement principles outside of the body. Let's just describe like the patterns of movement in these problems you're experiencing. We don't necessarily have to turn it to the body first. And
Yeah.
there's some of that. And then there's also some psychoeducation around, you really want to keep it this way. I'm someone who's trained a lot in the science and practice of there's this other way that affects very deep change. And I think there are totally verbal ways you can go about it. There's different approaches I use outside of movement in sessions too. But yeah, I think for a lot of people, I phrase it as we are experimenting here. And it's
Right.
okay if it doesn't work, and it's okay if nothing shifted in that moment. But pretty consistently with experimentation through this, our bodies interact with our mind. There's nothing that we experience through our body that doesn't impact our mind, or through our mind that doesn't impact our body. So it's it's kind of a leap of faith on other people's part when I'm asking to engage in this experimentation and try something new, but it's also a leap of faith that I have taken over and over again and I just have full faith in.
Right.
So,
Right.
yeah.
Right.
Yeah.
That's great. Thank you so much. I wonder if you just have any final thoughts on dance or queerness, dance therapy, as we kind of come to a close here.
Yeah.
And if not, no problem.
Yeah. I guess it's just an encouragement for, not everyone has therapy immediately accessible to them if they want to give it a try. That's so amazing. But dance is accessible to you always. And to be queer and dance in your own space with no one watching and seeing who you are when no one's watching, to intentionally go out and dance in other queer groups, those are experiences that will, even if you're not applying all these other like, now let's also connect that to your history and then maybe a trauma that happened and all this, that is still having really impactful change. So I encourage my fellow queer people to just get out there and dance, feels like my final note.
Yes, I'm just such a big believer in what you're saying, and I feel like it creates such healing not only individually but also collectively for our community. So, yes, thank you so much, Alicia. I would encourage anyone who's interested in this topic to read Alicia's article that we're going to be pushing out at the same time because you really go through a bunch of different kind of modalities and ways to use this form of therapy. So yeah, encourage people to take a look at that. And thanks so much, Alicia.
Thank you.